Good afternoon. This film is a video that is intended for the purposes for my RAD students in 1611 and for review purposes for my students in RAD 2612. My name is Dr. Bradshaw. The view that I am discussing today is the lateral flexion view. Lateral flexion view, of course, besides the bony structures that we normally look at on the routine lateral view, we have four things that we want to concentrate on the lateral flexion view, and they are numbered on this film. Number one, which is right here, and it is this small line that is drawn centrally located along the posterior aspect of the vertebral bodies. That is called George's line, and so we're looking at the condition of George's line to look at the condition of this person's cervical curve. What we are looking to see is a smooth, continuous line, that there are no interruptions and there are no stair steps, but there is a smooth, continuous line. And so that is number one. Number two is this small line that is right here, which uses the most convex portion of the spinal laminar junction line. And so here's the line, here's the line, here's the line, and this, of course, is called the posterior cervical line, posterior cervical line. Number three, by the way, for posterior cervical line, just as with George's line, you're looking to see a smooth, continuous line, that you do not have an interruption of a line and that you have a continuous type of line. And that includes the segment up here, C1. That includes C1 for posterior cervical. Number three is designated right here, and that is the ADI. Now, we measure the ADI on the routine lateral view, and what we want to see or not see on the flexion view is we do not want to see this measurement change more than 1 millimeter from whatever it measured on the routine view. If you see that it has changed more than 1 millimeter, then you need to be worried about a laxity of the transverse ligament, allowing that C1 segment to slip slide across the top of C2, which indicates to you that you have an instability in that area. So number three is designating the ADI, and it is a measurement that we do on the routine lateral view, but we want to make sure that upon flexion, this space does not increase or decrease more than 1 millimeter. Okay? The last one would be number four, which is designated right here, and this is basically called interspinous spacing. As the person flexes their chin to their chest, you want to see equal amount of fanning between these spinous processes. If you see that two sort of lock together and do not equally fan out as the person flexes their head, then it indicates to you that you have some kind of hypomobility at that segment level. So we are working on a lateral flexion view, and again, we have four things. We have George's line, we have posterior cervical line, we have ADI, and we have the interspinous spacing, that we want to see an equal gap between these spinuses. That concludes everything that I wanted to say about the lateral flexion view, and I hope that you have a good afternoon.